Okay, 7 o'clock. Hi, everyone. This is Dr. Clayton Moliver. Thank you for participating in our latest webinar. This one is on facial rejuvenation. First, a few housekeeping chores. I didn't expect you to see me, so I'm going to have to maintain good posture tonight. We will send you an email tomorrow. We're going to ask you to review our webinar, give us some feedback. It's just a few brief questions. In that email, there'll also be a link both to the recorded session of tonight, because I'm going to go through a lot of information, and there'll also be a link to YouTube. So I hope you'll share it with your friends and family, and they can watch the webinar too, and just sort of get a free consult as if you were visiting in my office for an hour and I was telling you all about facial rejuvenation. I'm going to go through a lot of the modalities that we have to offer in our office. It's not meant to be a marketing pitch, but it tells you what we can do for you. But hopefully it's educational as well. Also, you'll be able to click on a chat link. You should see that in the upper left corner. And if you go wait towards the end and start sending your questions in, or I don't mind if you send them in during the webinar, I'll probably start answering them at the end. I'll just read them and answer them. You're muted. You can't talk to me. So you can send chat messages. And it will be anonymous, so don't worry about that also. That's about it. Oh, one more last thing. Everyone, please raise your hands if you have any questions right now. I'm only joking. I really can't see you. Okay, here we go. So aging is mostly environmental plus genetics. You've probably noticed that maybe an Asian friend of yours or acquaintance might be 60 years old and they look 40. It seems unfair. Or maybe African American people that you might know look a lot younger than they are. And this has to do with genetics. A thick dermis makes you have less superficial wrinkles and makes you look younger to most people's eyes. So a lot of the things that we do in dermatology, in plastic surgery, is aimed at thickening the dermis in Caucasians, in Asians, in Blacks. That's what makes people look younger. As we get older, our dermis thins out. It just gets thinner and thinner and thinner, and it loses elasticity. Somewhere around age 45, we start losing one of the collagens, and there's about 7 or 8 different types in the skin called elastin. And therefore, our skin becomes more like linen and less stretchy, like a stretchy sweater or spandex, for example. And so instead of our skin hugging our body, it starts hanging on our body, and that's what we interpret as aging. But the other environmental factors are things like UV radiation, smoking, diet, lack of sleep, and large weight changes. All these things can contribute to the appearance of aging. If you wait until you're past 40, 45 to lose a bunch of weight, well, that skin's not going to snap back. It's going to hang. If you smoke a lot, we know that it has a lot of chemicals in there that really harm the appearance of your skin. If you're not hydrated, you'll look older. If anyone's traveled to mountains and wake up in a very low humidity area, you look a lot older because your skin's not hydrated. But probably the biggest factor is UV radiation. There's been very good studies showing that truck drivers have a much higher incidence of skin cancers on the side of their face that's close to the side window. So UV radiation causes a lot of facial aging. And the best thing you can do as far as topical agents on a day-to-day basis to prevent aging or diminish the signs of aging is to use some sort of sunscreen. So with those things in mind, let's start our presentation. First of all, I'm proud to say that we now have 4 plastic surgeons in our practice, and we have an office in Webster where we do most of our surgery. But we have an office that opened about a month ago in Pearland on 288, just south of the Beltway in the Memorial Hermann building. And coming in December, we'll be opening another office on Bins in the Museum District up in Houston. And we will probably be expanding to a few more doctors come spring. we'll be offering most of our esthetician services in all of these locations. We'll be offering our skincare products in these locations, and most, if not all, of our lasers and skincare options in all of these locations. So if you're closest to one of these, you want to be seen in one of them, we'll be happy to see you. Not all the doctors will be at all of them, but many of us will be rotating at each one. So what is facial rejuvenation? Facial rejuvenation can be any number of things depending upon what our diagnosis is, what bothers you the most. So certainly people come in and they want a filler. They want their lips plumped, or their cheeks made a little bit fuller, or their nasolabial folds filled out a little bit. Or perhaps the texture of their skin is getting to be a little bit rough and they want a chemical peel to smooth out their skin. Or they want Botox or Dysport to smooth out or relax some wrinkles in the crow's feet area, in the glabellar or between the eyes area, or the forehead, or around the mouth. Or maybe they really feel like they need a facelift. And how do you know which one of these you need, or do you need something that intense? So I look at facial aging, and hence facial rejuvenation, in terms of three major concepts. The first one that I look at when I look at someone is skin texture. And skin texture is little red spots, little brown spots, little fine line wrinkles, coarse skin that lacks the plumpness and the smoothness of young skin. And a facelift is not going to change the skin texture. If you bring me a suit that's wrinkled and too large for you, I can bring in the suit, but it doesn't change the fact that it's still wrinkled. And people oftentimes mistake what a facelift can do, excuse me just a moment, what some of these lifting and tightening things can do for helping the skin texture. It won't help them. So I look at skin texture first. And then if that's the biggest problem, or if that's the biggest concern of my patient, then we start going off in the direction for things that can help texture. The next thing we look at is volume. As we get older, our facial skeleton actually shrinks. We now have CAT scans that show in people sequentially at the age of 40, 45, 50, 55, that our facial skeleton shrinks down. But not only that, we all know, we all see our friends in our family see the subcutaneous tissues getting flatter and smoother. Plumpness is young, and so we add volume back in the form of filler or other modalities to make people look younger. And that's one of the things we look at in facial aging, is how much volume loss has someone had. And then the final thing I look at is structure. Are their eyebrows drooping? Are the skin around their eyelids drooping? Is their malar, their cheek area drooping, causing a nasolabial fold or jowls? And is their neck drooping? No amount of skin care and skin smoothing or volume is necessarily going to help these kind of things. And so each of these things together come together to form a composite whole picture of the face. And it's my job to say, is the structure the biggest problem? Is the skin texture the biggest problem? Is the volume the biggest problem? Or are two or three or all of them? And what sequence of events and treatments are going to help you the best? So in terms of skin texture, we always try and do the least invasive and then move towards the most invasive, the more invasive. And least invasive are going to give you the least results, but they're going to be the least amount of downtime. More invasive is going to be a bit more aggressive, perhaps a bit more downtime in certain situations, more swelling or more oozing or something, but typically they have a more lasting effect. So we can go and use medical grade skincare products. We carry SkinCeuticals. These often have various different agents within them that are going to help cell turnover. They're going to help exfoliate the top layers slowly so it's not noticeable during the day. But with continued use, they're going to help improve the texture and tone and appearance of your skin. Our estheticians do chemical peels. We have several different kinds of chemical peels, very light glycolic peels, or we can go to medium or even aggressive trichloroacetic or TCA peels. These are the kind of things that we apply, and maybe you're just red for an hour, a lunchtime peel. And a series of glycolic peels over a few weeks will freshen up your skin and make it look smoother and more refreshed. Alternatively, we can go for a more aggressive peel, a VI peel, a TCA peel. These are various different types that will make your skin, the superficial layers, peel and look more fresh and clean. But it might take 3 or 4 or 5 days for that whole process to transition so that you're presentable again. We do have some other techniques